Okay, we're gonna start with some palpations of the hip and the pelvis. We'll start with the pelvis. So have you stand up. We're gonna do ASIS, umbilicus, McBurney's point, and SI joint. So start with the ASIS. Is it okay if I palpate?
Yeah.
Right here?
Yep.
The umbilicus,
My
belly button.
Yep.
McBurney's point is right in between the two.
On the
right side. Oh yeah, on your right
Yeah.
side only. McBurney's point is right in between. And the SI joint. Posterior.
Yes. Sorry, we're gonna stay close there.
So I'll actually just go into the next palpations. So we have the PSIS, which is going to be
Right around there, yeah.
right around there. And then the iliac crest is going to be up here. SI joint would be just above.
I think inwards, right?
Just inwards of the PSIS. We have, I'll turn you around. Sorry, we have the sartorius muscle coming around this way. We have the rectus femoris, vastus lateralis, vastus medialis, and the vastus intermedius would be deep to rectus femoris.
Yep.
We have the adductor muscles that run on the inside on the medial portion of the thigh, glute max.
Let's do the TFL real quick.
TFL is going to be right on our side, so we're going to find the greater trochanter. I'll have you do some external internal rotation. Right below that, we have the TFL into the IT band.
Yes. And then you can do glute med standing up, and then we'll go
Perfect.
into glute max initial tube.
Cool. Glute med is going to be the little dimple right behind the greater trochanter.
Yep.
And then I'll have our patient lay down.
Make sure I won't break this table.
There we go. Okay. We have the gluteus maximus. Let's go. Let's see. Is that all that I have? Glute med.
Glute max and then ish tube.
Ish too. Gotcha. That's it. Okay.
Yep.
So glute max is obviously just the butt muscle.
Yep.
Here, greater trochanter. It's okay if I palpate you.
Yeah, you're good.
Awesome. We're gonna push down and up.
Yep.
And it's the sit muscles or sit bones. All right. Special tests for the hip. We can do them kind of in a reverse order. Let's do Thomas test.
Okay.
So since you're in that position, so I'll have your PSIS at the edge of the table. I'm gonna have you grab one knee and then lean back.
I'm gonna like that.
Gotcha. Grab one knee. Oh, got. Okay.
Yep. And then lean back like that.
All the way to the table. Gotcha. Okay, and then do both sides. Does it matter for all these or?
No.
Okay. Gotcha. And lack of hip extension. We're looking for psoas and rec fem. Tightness, hip scouring. I am going. All right. So I'm gonna have her sit back. I'm gonna take her knee like this. I'm gonna apply downward force and then externally and internally rotate. And again, with hip scouring, we're looking for labral pathology. If there's pain with it, torque test. We're looking for a stress fracture here. So I'm gonna have her allow me to put my fist underneath her femur, underneath the femur. And I'm gonna push down at the knee. And we're looking for pain there to see if there's a stress fracture deep within that femur. 90-90 straight leg raise. So I'll have her go up to 90. We're gonna have her lift one leg all the way up.
It's not fully straight.
Not fully straight, so there's a little bit of hamstring tightness there. And then the other one, also not quite there, so a little bit of hamstring tightness. as we've seen in class many a times. The Faber test is going to be looking for SI joint involvement. So that's the one we're going to have you bend both your knees.
I don't remember this one.
Faber,
It's
heel
this
over
one.
opposite
Yes,
knee.
like this.
Yep. And then we're going to let it relax and I think that's it.
Yeah.
So if it doesn't go all the way down, it shows SI joint involvement. So some tightness there. We'll do Trendelenburg's last. Ober's test. You're going to be on your side.
Side. Then you'll come over here. And this is for the IT band. Do you remember this one?
Yeah. So we abduct, pull back, and then release.
Yeah, you'll release the one that's holding the knee, but keep the one supported where the ankle is. Does that make sense? So keep that one.
Okay, gotcha. Okay, so abduct, back, release.
Yes.
Gotcha.
And it's supposed to drop, and if it doesn't, then it's not tight IT band.
Gotcha. And you had a good drop. That was good.
Good.
Okay, sweet. And then we have piriformis, so legs stacked on top of each other on our side. We're gonna have our top knee slightly up forward, and I'm gonna apply a force downward on the knee. And that pain, if there were any, would indicate tight piriformis. And then lastly, Trendelenburg's test. So I'll have you stand on one foot. We'd ideally do it for 10 seconds both sides, but here we're just looking for a drop in the pelvis. If the pelvis dips, weak glutes or instability in her hips. Do the pelvis special test, so we'll measure for the leg length. So true leg length is going to be ASIS to medial malleolus. Functional leg length is umbilicus to medial malleolus. So true would be ASIS to medial malleolus. Functional umbilicus there. We're looking for difference in greater than 1 centimeter side to side. Gapping test, we're going to have her laying on her back. I'm going to cross my hands, get the ASIS and push down and out. Looking for pain there, which could indicate SI dysfunction. Lung sit, so I'm going to observe her medial malleoli as she's laying here, and then as I am going to instruct her to sit up, I'm going to pull her legs out and check them again. So I'll have you sit up.
Yeah.
Sorry, a little late there.
Yeah, you don't gotta go so hard, sorry. This is a slow grab.
Okay, I almost pulled you off the table there.
No, yeah, it's okay though. And then you just check.
The medial malleoli look great, so.
Perfect.
McBurney's test, last test. Okay,
Yep.
So we're going to find McBurney's point, which again, right side between umbilicus and ASIS. And then we're going to push down on umbilicus. And what we're looking for is pain with that rebound, which could indicate appendicitis.